Hi, my name is Nicole Diefenbacher, and I am the Social Media and Communications Coordinator here at Vibrant Emotional Health. Vibrant believes that wellness should be achievable for everyone. With this in mind, and in honor of July being Minority Mental Health Month, Angela Mora-Vargas, Assistant Vice President of Programs here at Vibrant Emotional Health, has joined us to discuss mental health within the Latino community. Hi, Angela, how's it going?
Good. Thank you, Nicole. And thank you for this opportunity to talk about such an important topic.
Yeah, absolutely. So my first question here is, what are some of the mental health concerns facing the Latino community, and how are those concerns exacerbated or impacted by the pandemic and the protests?
Mm. Well, the Latino community is considered one of the groups at higher risks for depression, anxiety, and substance use disorders. At this time of social unrest in the COVID-19 pandemic, Latinos may feel disconnected from the larger community due to language barriers, maybe facing financial instability, and being fearful of what tomorrow will bring. All of these are reasons why they may be at a higher risk.
Yeah, absolutely. So what are the barriers that Latino people face when seeking mental health services?
A language barrier may be one of the reasons that the Latino community is not seeking mental health supports. A lack of appropriate health insurance, minimal information on mental health, and facing a real stigma when reaching out to receive appropriate mental health supports are all reasons why, they may not be reaching out to obtain that assistance.
What can allies do to help support the mental health of people of color in their lives?
Being present for the person experiencing the challenge and letting them know that they are there to listen non-judgmentally can make a huge difference. Promoting for them to establish limits on their consumption of social media, TV coverage, maybe helping them to know that it's important for them to take care of themselves and they can stay active. It's important for them to do things such as, staying hydrated, eating a healthy meal, staying away from or decreasing their consumption of caffeine and alcohol use can all make a difference during this time. And most importantly, staying connected to loved ones or friends can be helpful. And so if those resources may not be available, we also have a resource that's available 24 hours a day, 7 days a week. That's our Lifeline. And the Lifeline number is 1-800-273-8255. And we also have the Lifeline in Spanish. And the number is 1-888-628-9454.
That's awesome and really, really helpful. What are some myths we can all work to end about the Latino community and mental health?
In the Latino community, there's a real myth about mental health support. Hispanics may face feelings of shame or guilt if we have to consult with a therapist or a psychiatrist. In our community, the stigma around someone seeking out support means that the person might be crazy or local. And the reality is that just as physical conditions may require appropriate professional help, sometimes our minds may be experiencing challenges and we may need to seek out appropriate professional help.
Yeah, absolutely. So what can mental health professionals do better to support communities of color, and what resources are available for Latino people looking for support?
Well, mental health professionals need to understand the unique experiences of the Latino community. They need to be culturally and linguistically competent, be respectful of each person's individualized strengths, and be open to learning each day on how to better support our community. There are resources available 24 hours a day, 7 days a week. Our Lifeline number is available for everyone that may be experiencing challenges, and the number is 1-800-273-8255. And it's also available in Spanish at 1-888-628-9454.
Awesome, thank you. Are
Thank
there
you.
steps that individuals can take to support someone who might be going through a mental health crisis?
Well, the first step is to first ensure that the person is safe. Once you've established that the person is not at risk of suicide or harm, then you can move on to that next step of letting the person know that you're there to listen non-judgmentally, to be patient with them, provide them with information and resources. And the reality is that sometimes the person that you're trying to assist may not be ready to receive the support at that time, and that's okay. What's important is for them to know that they're not alone, that others may be experiencing similar challenges, and that there's resources available to them when they're ready to reach out.
Awesome. That's really great advice. Thank you. Thanks so much for talking with me today, Angela. If anyone has questions about this video or topic, please feel free to reach out to us in the comments and we'll be happy to connect with you. Be sure to follow us on Facebook, Twitter, and Instagram at Vibrant for All, and keep an eye out for more videos just like this one coming soon.